To start the Health, Human, and Social Services meeting, please. Glad to see everybody back. I'd like to welcome Supervisor Driscoll, who's now going to be on the committee with us. And we didn't have Rob from Mental Health on the agenda, but he only has one item, so I'd like to start with him so he could deal with that and then go back to what he needs to do. So with that, Rob, I'll turn it over to you.
All right, thank you. My apologies, came up kind of late here. I have a request for application for approval to enroll in job-related courses. Our program analyst, Carrie Wright, is enrolling in Masters in Public Administration program from Marist. And I put a copy of the, I don't know if it's the county policy or the benefits manual or what, but there's a copy here that Human Resources has forwarded to me indicating the parameters for seeking this sort of reimbursement, 50% cost of tuition. What she's doing is she's taking one course at a time. It's an online program. It's an 8-week course. It's condensed. And so again, I'm not sure how the committee views these things, but
I'll move that.
Right, okay.
I'll second it.
All right, motion by Mr. Loeb, seconded by Mr. McDevitt. Any questions?
In answer to Rob's question of how the committee, personally, I think is education subsidizing programs are fantastic. So I'm in full support.
I agree with you on that. Supervisor Sokol.
Thank you, Madam Chair. Rob, you said that you don't have funds for this stuff?
well, I wasn't sure how to answer the question. Okay, because right now I don't have money budgeted
I saw the
for
notation.
tuition reimbursement. I mean, I have some funds in my budget that are like within our training and travel line. That's what we usually pay for, you know, trainings and conferences. If that's not appropriate, then we also have a consulting line that we probably have some funding there that I could transfer over.
Are we good on that?
We're good.
All right, any other questions? Supervisor Driscoll.
Madam Chairman. I think these are wonderful opportunities to enhance departments. My question is a general question. Is there a period of time that an individual needs to stay in the employ of the county in order to benefit this? I mean, can they graduate and then get a job opportunity elsewhere 6 months down the road? And
On the handout where
Because, okay, I missed that.
reference of the benefit, it does say that if the employee does not work for at least 18 consecutive
Oh, okay, I'm sorry, I missed
after
that.
completion, then they have to reimburse.
Good, thank you, sorry about that.
Okay. Any other questions? All right, all those in favor?
Aye.
Opposed? Carried. Thank you kindly. I need to go back a minute, though. I need approval for the last meeting that we had. Supervisor McDevitt, seconded by Supervisor Loeb. All those in favor?
Aye.
Aye. Opposed? Carried. Thank you. All right. Office of the Aging, D. But I'm going to start. Does everyone have the handouts from D? I don't want to start until they all have their handouts. Okay, D, I'm going to start with Ryan first, and he'll explain what's coming down. So we all need to be listening. Some of this is going to sound familiar to a lot of members of the committee.
So there's an issue that came to my attention that I've looked into, and administratively we can't solve this issue. We need the board to either take action or not take action, starting with this committee in terms of what the pleasure of this committee is. The Clements Law Firm used to provide legal services for seniors in the community who were things like eviction proceedings, just to help these senior clients out. They're clients of the Office of the Aging. There were $1,070 worth of services provided by the Clements Law Firm in January and February of 2018. During the course of discussion of a separate issue that was before this committee back in February last year, Supervisor Bramer moved that the county pay for any expenses that the Clements firm had incurred in 2018, and I believe Supervisor Sokol seconded, and the motion was adopted unanimously. However, it never went to the board for a resolution because there was some confusion over the intent of what this committee wanted to approve. The confusion had to do with whether the 4 clients in question that generated those bills were active clients of the Office for the Aging or whether they were not. There was also a factor of the funding for this program. This program is funded through 2 different sources. Federally through 3B, which is a reference to Article 3B of the Older Americans Act that authorizes the funding. That's the bulk of the funding, $16,000. And the second part of the funding is state funding, CSE, Community Services for the Elderly, for about $2,000. Now, these 2 funding sources, for the first time in a while, in 2017, dried up. And providers were notified that the money was drying up and new clients were not to be taken on. However, the Clements Law Firm had an ethical obligation to continue providing services for its existing clients, and 2 of these clients it's a married couple, and there are references to the money that was left over paying for those cases because we knew we would have expenses. The other 2 clients in question, we'll call them Client 3 and Client 4. Client 3 had been involved in a a foreclosure proceeding that it was still dragging on. And Client 4 had previously settled on a foreclosure proceeding, but was found to be in violation of the settlement, so the Clements firm was working to get them back into compliance with the settlement so that they wouldn't lose the house. Anyway, long story short, the cost for the first 2 clients combined is $160. Client 3 is $700, and Client 4 is the balance at $210, $220, whatever that adds up to get to $1,070. I asked the law firm, what recourse do you have when you know that the funding is exhausted? Do you have the ability to stop providing these services? There's essentially 3 options. One is the clients pay, if the clients can afford to pay, which in this case I don't believe they can. 2, the firm can take on this work on a pro bono basis. Or 3, the firm can ask a judge to be removed from these cases and a different attorney assigned to these clients. That process did happen in March of 2018. The costs that were incurred by the Clements firm from the middle of 2017 through the end of 2017 were taken on a pro bono basis. They did not accept fees and are not looking to get fees paid for those services. And I thank them for doing that. The costs associated with January and February, it was also not their intention to come to the county looking for a refund of that money. But this issue arose because the motion was made during the committee meeting last February. So that's the issue we're dealing with, is whether or not this committee would like to pay that $1,070 for these 4 clients that I've outlined. And the Office for the Aging has, to this point, not been able to make that decision on their own because, again, there was confusion about whether or not these were active cases. And also, to Dee's credit, looking out for the county, these funding sources, the federal and state money, are dried up, and if we do pay this, it's going to be $1,000 out of the county funds. I will also say that Dee has instituted some savings this year in meal sites, and she'll touch on some of that. And those meal sites, we're way over our local match on the meal sites, so any savings in meal sites is 100% savings for county. So from a financial point of view, we would have the money to cover the $1,000 if that's what this committee wants to do. So if it's your will to authorize these payments, what we would need to do is amend the prior contract with the Clements Law Firm to allow these services to be reimbursed.
Questions?
I would make a motion to that effect, precisely what you said, that we make...
Okay, a second to that? Supervisor Driscoll. Okay, now, questions. I did see your hand first, Claudia, so Supervisor Bramer.
Thank you. I was just going to say, I will renew my motion from last February that we pay them what they incurred in costs, and I thank them for their pro bono services after that time period. And if we need to take it out of contingency fund or somewhere else rather than her budget, I completely would support that as well.
All right, any other questions? Supervisor Loeb?
Madam Chair, if we already passed the resolution in February, why do we need another resolution?
The resolution didn't go to the board.
Right, but this committee already passed the resolution.
Correct, but the problem was we were trying to make sure that we understood exactly what the committee wanted to approve and that you know all the details about the 4 clients and the funding we're drying up, all of that stuff, that you have the full fact pattern and can make a better informed decision. We thought it best to bring it back to this committee again.
All right, this is Supervisor Sokol.
Thank you, Madam Chair. And if you don't mind with your motion, move it to finance, and I believe that's next week, so maybe in that time, we can figure out whether we need to take it out of D's budget or we can take it out.
All right, sounds like a good idea.
I think it's a very
Any
good-
other questions, Supervisor McGowan?
Yeah, I just want to thank you for all the years in the past of all the hard work you've done and your patience with waiting till we figure all this out, so.
I would echo that and also thank Dee for looking out for the county and making sure that the i's are dotted and the t's are crossed.
Any more discussion, Supervisor Loeb?
Yes, thank you, Madam Chair. The question that you said the Office for the Aging couldn't figure out as to the appropriateness of the status of the clients, has that question been answered?
It's a
That's the
matter
resolution, but that
it-
question
it-
answer is still floating in there?
It's a matter of interpretation. For instance, the final client that went through got assistance in the foreclosure and they reached a settlement, you could look at that and say that the work to make sure that they were in compliance with the settlement was a new task, and that it should have gone in for recertification with the Office for the Aging. In the past, I've been told that those situations were that the past offices for the aging were not sticklers and would let those through. So the answer is it's a gray area. It's open to interpretation as to whether or not these were active clients. That's why I wanted to bring it back and make sure that this committee understood exactly what was going on with these 4 clients.
All right, Supervisor Driscoll?
Thank you, Madam Chairman. Not a question, but a request to Mr. Moore. As a not-for-profit administrator for many years, I've been given, say, $10,000 and used that to best serve the public. Am I doing a better job if I serve 4 families an average of $2,500 or 10 families an average of $1,000? So maybe that's just a discussion we could have in the future with other departments that get really limited funding in order to do annual work.
I do know that in the past, the law firm that was involved with this contract, in sensitivity to those funds running out, started to discriminate more in terms of the cases that they would take on to make sure that they were worthy cases where they could actually stretch the money to do the most good.
Any other questions, or
Just,
Kim?
Mrs. Clemens, did you want to say anything, or everything cool? Thank you for coming.
You're welcome. If anyone has any questions, I oversee the billing of the office and assist Mr. Clemens in representation of these people. If you have further questions, as an example, clients 1 and 2 that involve taking an appeal to retail decisions in departments, and 2 mandatory task conferences that don't happen in the course of every appeal. So we have no way of predicting that we would have to, go to solving with that. I don't want to go into detail, of all the clients.
Okay. Oh, good, thank you.
Thank you.
A lot of work was involved, and those were just the clients that we continue to represent in January, of course, of 2017.
Okay, thank you.
Many clients.
Thank you very much. All right, can we vote on that now?
We certainly can.
All right, all those in favor?
Aye.
Opposed? Carried. Thank you, and thank you very much for coming and expressing. Supervisor Bramer?
Just before we move off that, could we have an update on how it is going with the current provider and numbers and like Supervisor Driscoll just said, the differences between serving, multiple clients versus fewer clients but more in depth, that kind of thing?
Well, I don't have the exact numbers in front of me, but I can tell you with the new agency we're using, we are not going to run out of funds, and they're going to represent anybody we send them.
They're
So-
not turning clients away?
No. And regardless of what the matter is, they're able to address it.
Excellent.
All right.
And are they following up with appeals, do you know?
I would have to ask them specifically that, I don't know.
Okay. Thank you.
All right, with that, then we'll go on to your agenda, Dee.
I apologize, it's a little lengthy, we had quite a few things that we need to address. One of the first things I wanted to point out to you is I typically give you guys an explanation of all the funding sources we get, what's included under that funding source, how much is federally or state funded, and then the maximum amount that we are anticipated to get from NYSOFA this year.
Thank you, appreciate that. It gives us a better idea.
The first item on the agenda is permission to amend the CSE contracts for 2019. We were given some additional funding this year for CSE, which is Community Services for the Elderly, from NYSOFA in the amount of $14,489. So we are looking to increase some of our contracts that we have for that service. And also with that, with the transportation contracts, we are not requiring 50% match, as they've already done their budgets for the year.
All right, someone like to make that motion? Supervisor Sokol, seconded by Supervisor McGowan. Any discussion? All those in favor?
Aye.
Opposed? Carried. Thank you.
Item number 2 and 3 go together. We have an opening at our Johnsburg meal site cook number 10. She has left due to medical reasons. In the past, since 2016, any time a position has become open at a meal site, we have looked to see whether or not we can decrease the hours. And we have decreased all of the cook hours from 30 to 25 hours a week. So we would like to do that for this position, and then also permission to fill it. Reducing the hours would be an approximate cost savings of $3,429, and due to longevity, filling the position, we would have a savings of $5,699.
All righty. Would someone like to make that motion? Supervisor Sokol, seconded by Supervisor McGowan. Any discussion? Supervisor Bramer?
Thank you. When you said is that all the other cooks are at 25 hours?
Except for the Cedars location.
Are we saying that this motion is for both 2 and 3? Dee, is that how we want to do it? Put the 2 of them together?
If you can.
Okay. All right. Any more discussion? Yes, Mr. Wild.
Chairwoman, thank you. I just have a question about living wage. When we go from 30 to 25 hours, are they losing benefits, health benefits and the like? So it's good to think about reducing our costs and controlling our costs, but we also have to think about the people involved. In my experience, with the kind of person we have at centers last year, just made me think about the people that are providing the service and do they have a living wage? And does this make sense? Just a question. Right. Thank you for your time.
Right. Any other discussion? Supervisor Bramer?
Well, on that, what is this person going to make at 25 hours a week? Is it?
They will be making $27,438. So that's the 40-hour a week amount. So it'd be a little bit less than that.
Base salary on this page, it says 27,438 at 25 hours per week.
I think the base salary, well,
Oh, I see what you're saying.
that's the base salary, but it'd
40 hours
only be
a
at
week.
25 hours a week.
Well, that's not a living wage. They're also not working full-time.
But they may realize it's a part-time job when they take it on. I mean, so you kind of have to look at it that way, too. Any other discussion? Supervisor Leggett?
Yeah, thank you, Chairwoman. There's also other help that towns pick up for these meal sites, correct?
Some
That-
towns,
that-
yes.
That the county does not pay for.
Yes.
I know that,
Some of the towns.
you know, in the town of Chester, we have other persons working in the kitchen as well to help out, so, just saying.
Okay, well, we have a motion and a second to the motion. So let's act on that. All those in favor?
Aye.
Opposed? Carried. Thank you.
Item number 4, actually, the next few items, they kind of go together. In the past, we have not utilized all of the ISEP funding that we have gotten from NYSOPA, so we are looking to expand those services, and with that, it needs some new contracts. So item number 4 is permission to enter into a contract with Port Hudson Health Systems to provide personal care level 1, personal care level 2, case management, and social adult daycare services to residents of Warren and Hamilton counties. The ISEP contract will be for $85,000, and the Title IIIE, which is respite caregiver, the social adult daycare, will be $23,000.
All right, someone like to bring that motion to the floor? Supervisor McDevitt, seconded by Supervisor Loeb. Any discussion?
So this is for 4 and 5, but
No, we're
only
only
4?
doing 4. Let's do them one at a time, just so we don't get ourselves... This is for number 4, so... All right, all those in favor? Claudia, I'm sorry, go ahead.
No, that's okay. I just wondered, I'm for it. I'm just wondering where these services are taking place. I see the one is transportation. Are the daycare services happening in Fort Hudson?
Yes. The personal care level 1, personal care level 2, and case management will take place in the homes, in the client's homes,
Here in Warren County?
in Warren County
Yeah.
and Hamilton County.
Okay.
And we can only do Warren and Hamilton County residents, we can't do Washington County. The social adult daycare and the transportation to the social adult daycare, that will actually take place in Washington County at Fort Hudson, but it'll be for Warren County or Hamilton County
Okay.
residents.
Question, Supervisor.
Thank you. We already have contracts with all of these entities now, or, no?
So
These are all
these are new contracts, yes, the one with Port Hudson.
Yeah, she says permission to
With
enter
Fort Hudson,
into.
But, I mean, we have, well, I'll wait till the,
Okay,
the Fort Hudson would be,
Would be new, yes.
thanks.
all right. So we have a motion and a second to that. Supervisor Leggett.
Thank you, Chairwoman. Just for clarification, on number 4, you have a request, but in our packet, we have 2 different
Right.
contract pages, and that would be the one covered under number 4.
Yes.
Okay.
There's 2 different contracts because it's 2 different funding sources.
Okay, okay, for the same services.
Yes.
Okay, thank you.
All right, any other questions? All right, Supervisor
Sorry,
Bramer.
just one more. Is this budgeted? These are new services that we're providing, and this was in your budget for
Yes,
2019?
we built it into the budget for 2019.
Okay.
All right, let's vote on it then. All those in favor?
Aye.
Opposed? Carried. All right, number 5, thank you.
This one again is a new contract. This is permission to enter into contract with Home Aid Services of the Central Adirondacks to provide personal care level 1 and personal care level 2 services under ISEP to residents of Hamilton County in the amount of $40,000.
Motion for that Supervisor Loeb, seconded by Supervisor Driscoll. Any discussion? Supervisor Bramer.
Are we getting reimbursed by Hamilton County?
Yes,
Okay.
any expenses incurred for Hamilton County residents, we are reimbursed for those 100%.
Any other questions? All those in favor?
Aye.
Opposed? Carried. Thank you.
Number 6 is permission to enter into a contract with Countryside Adult Home to provide social adult daycare services to residents of Warren and Hamilton County under the ISEP contract as well. And this contract amount will be $20,458, and we will reimburse, I think it's $45 a day.
All right, someone like to bring that motion to the floor? Supervisor Loeb, seconded by Supervisor McDevitt. Any discussion? Ms. Bramer?
Could you just explain what's happening? Is this us contracting with ourselves?
Yes. Well, we can't, we get money in Office for the Aging from the state, from NYSOPA, and then we contract out some of the services, or we do them all in-house. This is not a service that we can provide ourselves at OFA, so we're contracting with Countryside Adult Home to provide it.
Okay.
It's legit.
I was gonna say, it must be, or we would have heard about it by now.
It's a
And a way to keep the
requirement.
bookkeeping.
Ms. Bramer?
Yeah, we have to do that.
Ryan said it's a requirement.
For the state funding, in order to be able to access the state funding, they require a contract.
Okay, thank
We
you.
do that with, I'm sorry, we do that with Department of Social Services, I mean, it's contracting with other entities in the county.
And we do it with all of our meal programs, too.
All right.
Okay.
All those in favor?
Aye.
Opposed? Carried. Thank you.
Item number 7 is permission to enter into a contract with Hamilton County Public Health Nursing to provide evidence-based health promotion services to residents of Hamilton County under Title 3D in the amount of $3,460. And again, this one will be fully reimbursed by Hamilton County.
All right, motion set by Mr. Sokol, seconded by Mr. Loeb. Any discussion? All those in favor? Aye. Opposed? Carried. Thank you.
Item number 8 is we wanted to amend some of our schedules for the funding that we get to maximize the amount of funding that we have, increase some contracts, decrease others, and change services. So specifically with the Title 3D contracts, which is these two here, we are increasing the contract that we have with SAIL, Southern Adirondack Independent Living Center, to provide chronic disease self-management programs to residents of Warren County. You're increasing it to $3,459. And then it has the Hamilton County one that we just approved in there.
All right, someone like to bring that to the floor? Supervisor Loeb, seconded by Supervisor Bramer. Any discussion? All those in favor?
Aye.
Opposed? Carried. Thank you.
The next ones, they go along with that as well, but I'll explain them. So for Title 3D, which are these two sheets, the next ones, we are increasing our contract with Greater Adirondack Home Health Aides to $35,000 for the year, which is an increase of $2,450. We are increasing our contract with Hamilton County Public Health from $5,000 to $10,000. And we are changing the services from home health aid to personal care level 1 and personal care level 2 under the respite caregiver program. And then the rate will be $30.31 an hour. And then the last part is, we already approved this, was the contract with Fort Hudson Health Services.
All right. Someone like to make that motion? Supervisor Driscoll, seconded by Supervisor McDevitt. Questions? Supervisor Loeb.
I got lost here. We were number 8,
We're still on number 8, actually.
Right.
so there was more than one request under number 8.
Yes, under number 8. They told me I could do them all together.
Those for items.
Well, for all of the funding sources, the changes, they told me I could do it in one resolution.
And she's just walking you through each funding source
Okay.
right now. So we already did 3D, and now we're on to 3E.
But that's 2 resolutions. Are we doing one resolution?
I think
Just one. Amanda said just one, so
we
that
will...
was my mistake.
We will put this all in one resolution for the Board of Supervisors, but for the benefit of the committee, she wants to walk you through the changes for each funding source.
And do we need a separate resolution each time?
No.
No.
Need to move.
Go ahead, Dee.
So then for the ISIS contract, which is this one, we are reducing the Greater Adirondack Home Health Aid contract from $189,226 to $180,000, and we are adding a consumer-directed program. This will allow individuals in the home to find their own caregivers, but they have to have a fiscal intermediary so that we can reimburse that. We are reducing the contract with Hamilton County Public Health to $35,100, and we're changing the rates for PC1 and PC2 to $30.31 an hour. And then the rest were the 3 additional contracts that we already approved.
Okay. Any questions?
Okay.
Ms. Bramer?
Yeah, I mean, I understand costs going up. What's happening with the $5,000 reduction in the Hamilton County Public Health?
They weren't utilizing all of the $5,000?
I don't know. Less this one.
It went down $40,000. They
Oh.
weren't utilizing all of the funds, so we just did it for what they thought they would need for the year, and then we're changing those funds and putting them elsewhere. And some of the new contracts that we added.
Okay. Yes, Supervisor Hogan.
In more remote areas of the county to get home health agents.
This should assist with that, because we are branching out and having more contractors to provide the services, so we're hoping to be able to expand the services, not only to get new clients, but to get those more remote areas, and to provide more of the in-home care.
Like
Supervisor
the home
Brink.
health, home aid services of Central Adirondacks, will that help in the more remote?
That's for Hamilton County.
Oh, okay.
Yeah. To help with the more remote areas in Warren County, it's Port Hudson, which seems kind of odd because they're in Washington County, but they have aides all over the place. And the Greater Adirondack Home Aides, they service the more remote areas in Warren County as well. That is difficult because you have to find an aide from the area willing to work there. So that's difficult with any of the contractors we have. And we did reach out to all of the individuals that provide this service within Warren and Hamilton County, and we only got responses from Port Hudson and Home Aid Services of Central Adirondack. So out of the 20 that we sent out, agencies no response.
What about our own?
They provide their own services. They weren't on our list or who to reach out to.
You know what I'm talking about, public health? Yeah, okay.
Mm-hmm. But they weren't on the list that we were given by NYSOPA. You have to have certain credentialing, and you can only provide certain services.
All right, any more questions on number 8? All right, we've already made the motion and acted on it.
We have one more, sorry.
Okay.
The CSE contract, this one. With that one, we are just adding a contract with Renthal Hospital to provide medical alert and personal emergency response systems in the amount of $7,000. We currently have a contract with them to provide it for ISIP clients, but they can only be ISIP clients to get underneath that funding source, and we need to open up another funding source.
All right, Supervisor Bramer?
I'll make the motion, I have a question.
Already acted.
Oh, sorry,
No,
we're
we
still
already
on 8,
acted
yeah,
at the
yeah.
beginning.
Okay, I'm
and
sorry.
I wasn't aware she had a lot to explain. Go ahead.
So what is the new funding source?
CSE, Community Services for the Elderly. The other one was ISIP, Expanded In-Home Services for the Elderly Program, and you have to be a client of ISIP in order to get the FERS underneath them. So these are for the clients that don't meet the ISIP requirements.
And we're paying this, there isn't a, oh no, I'm sorry, there is state money.
There is money,
Okay,
yes.
yeah.
State
Okay.
and federal monies from NYSOPA, yes.
All right, any other questions, or can we move on now to number 9, if we finished up 8? D?
All right.
Okay,
And just to reiterate, with all of those, the funding is in the budget to provide.
okay, thank you.
Chairman, I think we still need to vote on 8.
No, we're all set. I
We
asked
voted-
Amanda.
I'm sorry.
We're all set.
Item number 9 is permission to amend our contract with Countryside Adult Home for the provision of meals to clients of Warrensburg and the surrounding areas. In the past, we have reimbursed them in an amount of $16,000 a quarter, and we would like to change it to a rate of $3.65 per meal. This will make it easier to actually determine how much we're providing and for the documentation that's required.
All right, well, let's bring it to the floor first. Would someone like to make the motion? Supervisor Lowe, seconded by Supervisor Sokol. Any questions? Supervisor Lowe.
Quick, what does the cost per meal have to do with the next sentence? Medical fees, office supplies?
Well, we are still required to provide separately the cost of the labor. It's not included in the contract, the medical fees, so the annual physical and PPD that they're required to have because they're out of the Countryside location, the office supplies, and then the cost of repairs to our own equipment. Those things OFA would still be responsible to cover on top of this rate.
Thank you.
And that's what we've been doing.
All right, any other questions? All those in favor?
Aye.
Opposed? Carried. Thank you.
Item number 10 is request to purchase food processor software upgrade in the amount of $499. The last time we had an upgrade was in 2010, and we did do our analysis of our costs.
All right, someone like to make that motion? Supervisor Loeb, seconded by Supervisor Bramer. Any discussions? All those in favor?
Aye.
Aye. Opposed? Carried. Thank you.
Item number 11 is permission to submit our 2019-2020 annual implementation plan. This was due on December 5th. This was a question that came up last year, so I clarified with the county attorney's office, and they said that we did have to have a resolution because it has a signature, the chairman of the board signs. But with the resolution that we have in front of us, it gives him permission to sign it for upcoming years, so I don't have to come back.
All right, someone like to make that motion? Supervisor McDevitt, seconded by Supervisor McGowan. Any discussion? All those in favor?
Aye.
Opposed? Carried. Thank you.
The next one is permission to submit our 2018-2019 MIPA grant, Medicare Improvement for Providers and Patients Act. It's a grant in the amount of $22,761. I'm sorry, I have this out of order. It is for the funding year of September 30th, 2018 to September 29th, 2019. Just received the grant application, and it's due February 22nd.
Supervisor Sokol makes the motion, seconded by Supervisor Bramer. Any discussion? All those in favor?
Aye.
Opposed? Carried. Thank you.
Item number 13 is permission to amend our contract with Catherine Keating Stotts for dietitian services. We just want to amend it so that there's no longer the clause that says 2 days of training, conferences, and seminars. They can attend, or she can attend, whatever trainings and conferences are necessary, as long as it's approved by the director.
All right. Supervisor Driscoll makes the motion, seconded by Supervisor McGowan. Any discussion? Supervisor Bramer.
This is a contractor?
Yes.
This woman, why would we pay for her training?
It's something she's required to do because of the services she provides for us, and it's just always been this way that we reimburse for the training and conferences.
Are we the only people that she services?
Yes.
Why isn't she a county employee?
Expensive, to be honest with you. And then you get into having to offer health insurance and...
More sense to do a contract. Any other questions? All right, all those in favor?
Aye.
Opposed?
I'm opposed.
Okay, noted. All right, thank you, Carrie.
The next item is permission to fill the food service manager position at Peters due to the resignation of the previous food service manager.
All right, motion made by Supervisor McDevitt, seconded by Supervisor McGowan. Any questions? All those in favor?
Aye.
Opposed? Carried. Thank you.
The last two items is just to let you know that we are accepting applications or nominations for our Senior of the Year. They're due February 8th, and I believe in the previous email that you guys got, it had the nomination form. These are for seniors of Warren and Hamilton County, the 60-year-old. The last item I have is just to give you an update on our annual evaluation that we had from NYSOFA that was completed on September 25th and 26th. Based on the report that we got back, the two areas that we needed to correct were our CARS report. They were not submitted by the due date. The report had been submitted, but it didn't show up with NYSOFA until the next day, so we had to submit it. And then with the client assessments, it said that one client case file review did not contain the most recent care plan, financial information, Medicaid pre-screen, or client agreement. This information had been completed by the contractor, we just didn't have it on the office yet at the time of the review. But overall, the evaluation went very well, and the staff at the Office for the Aging are doing a great job.
Very good. Glad to hear that. Anybody on the committee have any other questions for Dee? Anybody in the audience have any questions? Supervisor?
I would hope that, as we review these contract for services, that if we have assets in one county, someone can help with the provision of the services, take this into consideration, specifically countryside. Hate to see people have to travel long ways, travel long ways for services. Maybe looking forward, maybe some of the services, we have county assets that we should require the services to be provided with those assets. Just as an idea. I'm not saying it's even workable, but I'll put that out.
Well, that's why we're contracting for the social adult daycare.
All right, very good. Anyone else? Supervisor Bramer?
Just on the food service manager at Cedars, going back to Supervisor Wild's point, how many hours is that person working?
35 hours a
Or
week.
would they work? Will they work? We don't have anyone yet, right?
Someone is starting on Monday.
Oh, good. 35 hours and they're making 29,000, which I don't believe is technically a living wage either. On the guy's board.
But then,
Not
Claudia,
easy.
we are always having budget constraints that we have to watch what we're spending, so I don't know what...
Oh, it's in the collective bargaining agreement.
And they agreed to it apparently, so, right?
Yeah.
So if they agree to it, then I hear you.
Yeah.
Okay, I guess that concludes this portion, so we can then move on to social services, please.
Good job, Dee.
Good job,
Thank you.
Dee.
Thanks, Steve. Why was the DPW?
Oh,
They can wait.
Lunch are like that. Thanks, Chris.
Cynthia, I hear you. Your living wage? Not very livable. I make. Both down in the county combined.
See, now this will be a...
I have one. Can't wait.
I like it.
Thank you. How are you, Chris?
I like it.
Something along those
Yeah,
lines.
I take them off afterwards, and I stick them on my house.
Good place.
I like them.
They're nice.
Laura?
She's our judge, you know,
Sheila.
She really?
I'm all about saving money.
to have access to somebody...
They're just small enough they don't see them, you know what I mean?
Someone with a brain.
Yeah, somebody, a judge with a brain and...
Common sense.
Yeah.
Yeah, just to save $5,000.
Yeah, they did a nice job with it.
Yeah.
I don't like go-to, that's the only thing I don't like.
This is just a small county, but I wonder if they are able to approve it, have a director.
Yeah, they work hard, they're always...
Yeah.
We're all set, Chris, if you're all set. Claudia, are you all set?
Yeah, sorry.
Okay, thank you.
Yes, Madam Chairwoman.
Okay, Chris.
Thank you, Madam Chair. Good morning, everyone.
Good morning.
It's not your fault.
We have quite a long agenda here as well, so I'll try to condense it, keep it as straightforward as possible.
Okay.
I think the first things that we do have are some requests for personnel openings within the department. I will say up front that these are mandated and reimbursed positions. And with each position, I will let you know why the position is open.
Okay.
The first position is for an intake clerk number 7. And that's due to termination effective back in November. Second position...
Madam Chair, excuse me,
Yeah.
without objection, these have all been on the website. I would like to move all of these.
Well, we can move them, I think we should give them a chance to just explain to us. You know,
Okay.
that is a point of them coming to the committee, so I think we should at least give them a chance to.
Okay.
I know we're
We're
running
not that far
behind.
behind schedule.
Go ahead, Chris.
I'll move through these quickly.
Okay, thank you.
Take your time.
The second one is an intent to fill the position of Medicaid clerk number 3. That was due to a promotion, again, back in November. The next one is a notice of intent to fill the position of caseworker number 32. That is also due to a promotion which took effect in January. The next one we have is a notice of intent to fill the position of senior aide number 1 at Countryside Adult Home. This was due to a retirement, also in January. The next position is an intent to fill the part-time account clerk at Countryside Adult Home due to a resignation.
I'll second that.
Okay, well, all right. Who's made the motion? I'm sorry. Aren't we going to add those last two right along with it? No? Right. All right. Let's do those last two, Chris, and then we'll bundle those all together in one motion, okay?
Thank you, Madam Chair.
Mm-hmm.
The next request that we have is for out-of-title pay for senior aide number 2 at Countryside. This employee is filling in the absence of a director who resigned back in November. She's been doing a really great job stepping up and handling a lot of delicate matters that involve regulations, inspections, and audits, as well as working with the general program at Countryside on a daily basis. It should also be noted that she's a very long-term employee. She's been there for over 25 years.
Oh, okay, good.
This position also has 24/7 coverage, so she's on call, which she is dutifully accepted and carries out as we questions. The next is a request.
Excuse me, Madam Chair?
Yes.
Are we looking, you sound like you're doing a good job. Are we looking to fill that director position?
I believe you are looking to fill that
Yes,
position,
we
are you
are.
not?
We'll be
Yeah.
posting that on the website possibly today.
Oh, okay. Because I knew you were...
Position that we had emergency requested to fill.
Right.
And just to quickly give you a little background on that, why it hasn't been filled and posted yet is we had to do a little research to make sure that all the regulatory standards were in place before we posted it. There's been a number of changes to the position over the years, and this is a position that Department of Health has regulatory responsibility for. So we have to make sure that whatever we post out there is meeting those guidelines for the credentials, because we do have to submit those to DOH.
All right, thank you.
Thank you.
The next request is to temporarily increase the hours of the part-time senior account clerk at Countryside from 24 hours a week to 32 hours per week until a part-time account clerk vacancy is filled.
Right, so-
The next request is to fill that position, or to have that position temporarily increase those hours.
All right, someone like to bring that motion up for all of these that we just discussed. Supervisor McGowan, a second by Supervisor Bramer.
Well,
Questions?
actually, I'd like to bring up 1 through 5.
Okay,
I would move 1 through 5.
All right.
Supervisor McGowan, if you...
Is that all right, Mr. McGowan? We'll do 1 through 5, and then we'll go
I'll
back
get
to
back to
those
you in 5
next.
minutes on that one.
All right. All right, Supervisor Bramer on the second. All those in favor?
Aye.
Opposed? Carried. Now a motion for the last two. Supervisor Bramer.
Well, on the last 2, I'm not so concerned about increasing the hours for that part-time position till the vacancy is filled, but I would like us to take a step back before we do this out-of-title pay, because I feel like we've gone through this before, where we are paying deputies to fill the job of directors while that position is... I feel like we went through this all, not in Countryside, but didn't we come up with a policy about paying or not paying? I'm sorry that I don't remember.
About 2 years ago or so.
Because we...
It was discussed last year.
I do remember that, but I don't know what conclusion we came up with. Do you?
I'm glad I'm not the only one.
No, I mean, I remember we had a lengthy discussion on it.
Madam
Yes.
Chair, I can clarify.
Go
that.
ahead, Chris.
We are aware of that, and we did have the discussion prior to this. The reason why we're asking for it is because she does not serve in that capacity right now as a director or a deputy director. She's an aide within the bargaining unit, so she is actually conducting work well outside of the position that she currently has. So it's not like she's in a position of administration right now or management. My expectation would be if she was a deputy director that she would just fill in until we got a new director, but we don't have that position. So she's clearly stepping outside the bounds of her current position to do this work. So that's why we're asking for that.
So let's go back to Mr. Driscoll a minute. We'll come back to the Claudia.
Thank you, Madam Chairman. Chris, the individual who is pensioning, Does she have the credentials and certifications that the state requires in order to?
Yes, she does. I worked with Department of Health. I personally got the regulations and worked with Trish Denninger to make sure that this person did have the credentials and would be qualified. In fact, her credentials have been sent up to BOH.
Supervisor Bramer.
Thank you, that was exactly my question, but why is she not already management then?
You know, that's a good question, and that was a position that was filled before I became commissioner. I'm sure, my hope is that she will apply for this position once we get it posted.
I don't mean director, but just any,
She is in a supervision position within the unit. She's a senior aide, so she does have supervision responsibilities in certain areas. She's just not in an administrative role at that level of management.
We make a motion? I don't know. Supervisor Conover.
I remember this coming up in conversation,
Mhm.
when we were discussing this as a policy, that we do have a number of departments that do not have deputies or assistant directors, and represent transition strategy, difficulties in terms of whether somebody's out for long term or whether somebody leaves the position. We don't have people, somebody in the wings that can take over at a moment's notice to properly credentialed that understands the workings of the situation. And I remember that discussion. I think one of the examples was the planning office as an example. They don't have a deputy director of planning for any reason. Wouldn't have anyone ready to hold it before while we look for a new director. We would have to reach into the ranks in some fashion
Well, I think that's what Chris has tried to do, right? That he's looked into the ranks, that this is who he's come up with, so he's coming to make this request of us. So at this point, I'd like to entertain a motion to approve that. Supervisor Bramer,
I'll
second.
move those last two, so I'm calling them 6 and 7.
Okay. Supervisor McGowan, second. Any more questions? All right, all those in favor? Aye. Opposed? Carried. Thank you.
The next section that we can move on to now is a request for some resolutions here. The first one is a request to amend the contract with KMG, Michael Gray, for electronic monitoring services for youth. This contract was actually transferred over to probation for their input because primarily most of the clients that will utilize the service would be through probation, but occasionally there is crossover, and we're currently working on how we're going to go forward with this. But in the meantime, it's been traditional that the Department of Social Services has carried this. It's in our social services budget, so we pay for this. So we're asking that that be renewed for a period commencing January 1st through December 31st.
Someone like to make that motion? Supervisor Bramer, seconded by Supervisor Leggett. Any discussion? Supervisor Leggett.
Yeah, so how is this working with probation? Because this did come out with probation.
Yeah, and we actually have been working on that, and we did meet with Mr. Moore a while back in regards to this. So what we're doing is, as we go forward to the 2020 budget, we're going to make this a little bit more streamlined and have it be a little bit more clarified for everyone's benefit, including ours.
Covers everybody's needs right now.
Exactly.
All right, any more discussion? All those in favor?
Aye.
Opposed? Carried. Thank you.
Question. What is the funding source? Is it FFS?
No, it's SPSJP.
SPSJP, okay.
Guys, speaking another language.
All right, yeah,
Go ahead, Chris.
Glossary thing.
The next one is a request for resolution for a grant. This is a grant that will allow us to work with public health, who will provide a behavioral public nurse to work with our caseworkers in homes that might be affected by substance abuse or other issues. This will be a one-year term commencing December 1st and terminating November 30th of 2019. for a total amount not to exceed $50,000, which is the amount of the grant that we are getting from the state.
All right, motion by Supervisor Bramer, seconded by Supervisor McGowan. Any questions? Supervisor Leggett.
In regards to caseload on this, how, you have a lot of these things?
We do. Yeah, we have a number of these cases in different areas within the department. So what will happen is this worker will actually have a desk over at DSS. They'll be in our building for part of the time, probably not all the time. They're going to be doing a lot of field work as well, hand in hand with caseworkers in the community.
Trend on this?
It's hard to say right now. I think that my best guess is, and my hope is that things are improving in this area in our county. But it's hard to say because there's so much of it that's unknown as well, so it's hard to say.
Question, Supervisor Bramer?
Thanks. This is just a policy question. Does this involve, are you seeing kids with nicotine substance problems?
I think we have seen a lot of increase in those areas, not necessarily in regards to cigarettes, but to vaping.
The e-cigs,
Yeah, so vaping is becoming an issue, and it's something that we are working on within our department. It's something that has come up in our youth bureau meetings as well. So we're trying to get some of that information out there and educate. As you know, Madam Chair, you were at our last meeting. That was an issue that came up. It's something that we are working on. But yeah, nicotine is certainly a problem. And one of the problems with nicotine is that, like so many other drugs, there's always this push to make it stronger and more intense. And the vaping products actually administer more nicotine than a lot of cigarettes. And as we all know, cigarettes have been engineered over the years to have more nicotine and more addictive effects by the companies that make them over the last several decades. So it's an interesting thing and a good question, Supervisor. So yeah, we are working on this.
All right, any other questions?
I'd just like to make a comment on this because, this one in particular hits infants, folks that are, say, innocent of the situation as they come in, and as we as a society put so much effort into making the place a better world. I don't know how to put it, but the social ills that confront us, and I always wonder if we're winning the war on this. It seems to be a constant struggle, and every year we put more and more into it, but it doesn't seem to be that we're really gaining ground on this. So that's just a comment.
Thank you. All right, anyone else? All right, then we're going to vote on that. All those in favor?
Aye.
Opposed? Carried. Thank you.
The next resolution request is to authorize into an agreement with the Warren Washington Homeless Youth Coalition, also known as White House, in Glens Falls. This would be to provide services pertaining to sexual...
Excuse me, Chris, did we finish, did we do that second one? We only acted on the first one? The second part of that, to amend the county budget?
My apologies, Madam Chair.
Oh, okay, I'm sorry.
We are also requesting, which is necessary here, to amend the county budget to increase revenues and appropriations in the amount of $50,000 to reflect the funding to employ the public health nurse for this program.
All right, someone like to make that motion? Supervisor Sokol, seconded by Supervisor Bramer. Any discussion? All those in favor?
Aye.
Opposed? Carried. Thank you.
I'll move number 4.
All right, second by Mr. Sokol. Any questions? All those in favor?
Aye.
Opposed? Carried. Number 5, Chris.
Number 5 is to request authorization to appoint and reappoint members to the Warren County Youth Board for a 1-year term, starting January 1st through December 31st of 2019. Attached, you'll find those with the names of the individuals. I think everybody has probably seen those. If you'd like, though, I can go through them.
I thought we already did that, didn't we do that? First call.
We-
Didn't we do that at the full
All
board?
right, motion is made by Supervisor McDevitt, a second by Supervisor McGowan. Any further discussion? All right, all those in favor?
Aye.
Opposed? Carried.
And the last one is to request a resolution for approval for out-of-state travel for 2 foster care caseworkers to transport a child in the care and custody of Warren County Department of Social Services from Greensburg, Pennsylvania, back to Warren County at a cost of $250. This is a child who had absconded, and we located her down there, so we had to get her back home safely.
All right, Supervisor Leggett makes the motion, second by Supervisor McGowan. Any discussion? Supervisor Bramer.
This child left New York State while they were in our care
Yes.
with foster parents.
No, they were actually in a placement, and they were home on a visit, and this particular individual absconded with other people, and they took her to the other state. The child was actually not in placement at the exact time that
She left.
here.
Okay, well, that's good to hear, although also scary.
It does happen, though, especially with teenagers. Sometimes they do
Oh, yeah.
have to take off.
All right,
It doesn't happen that often.
okay, so do we have a motion on that? No?
Yep,
Yeah.
we did,
All right,
we did.
We do. All right, all those in favor?
Aye.
Opposed? Carried. Thank you.
All right, thank you. I guess the last thing that I have is to say that there's no pending items. I just have a quick update on DSS and Countryside, some things that have been going on. Back in November, we had the youth board meeting on the 19th. On December 3rd, we hired a new deputy commissioner, Christina Mastriani, who I know some of you know. She started as deputy commissioner. She's primarily over eligibility and is also working in a couple of other areas because she does have a lot of expertise in certain areas. So we're very pleased to have her on board. She's done an incredible job so far, really motivated, highly intelligent, and respected member of our staff for many years. So we're pleased to have her on board. And certainly, we're going to be able to pay more attention to a lot of things now that we have someone in that important position. So thank you all for approving that. Many months back when I asked for that, we did get an excellent person in there. I should mention that we had a lot of candidates applied, and we had several that were excellent finalists, but in the end, we were pleased that we could hire someone within the department that has been so excellent over the years. So
That's great. Happy to hear that.
on the 11th of December, I attended the Warren County Risk Management meeting. We discussed DSS exposure control plan in relation to dangerous drugs and labs, vehicle safety issues, bloodborne pathogens. There were a number of other topics discussed that weren't related to DSS, so I won't get into those here, but those were some of the things that we discussed. I had a commissioners convening in Albany on the 13th in December where we discussed the status of code blue plans, better practices going forward in regard to Medicaid issues, raise the age, caseworker turnover, which I know you guys are very well aware of because I come here and ask for those positions a lot. It's a real problem across the state having caseworkers remain employed for long periods of time. There's a lot of turnover. And with that comes the training aspect of it too, because the training is quite extensive. So whenever you get a new caseworker, they have to go to training for a number of months before they're completely up to speed. So that was a big topic of discussion, which is going on across the state. On the 20th of December, we had a workplace violence meeting, which we had to discuss specific incidents with various departments within the county. Mr. Moore was there as well, guiding that discussion. On the 10th of January, the new deputy commissioner and myself were able to go on a tour at Open Door Mission in Glens Falls. Kim Cook graciously took us around and showed us the program, introduced us to key staff, explained all the programs, and we came away rather impressed with what's going on down there. They have a lot of good stuff going on.
Can I interrupt for a second? I know I've talked to you before about the Open Door and all of the programs, especially in their new site, and how we as a county can collaborate with them more. So I'm really glad to hear that you went on the tour, and I would like you to keep looking at ways that we can work with them more collaboratively. And I know that Washington County provides them some funds for Code Blue efforts in particular, and I think that that's something that we should be looking at as well. I don't think I think there are opportunities for us to help without being redundant. Because I know that was something that you had were concerned about.
There are, and we learned about some of the other programs that are there, so we're looking at those to see if there is possibility that we might be able to include them in some sort of funding. The thing is that our Code Blue funds are the funds that we would have to use for that, and it's very limited what we get for Warren County. I think we get $40,000 a year, which is not a lot, and we are the last line of hope for a lot of these people. So if Code Blue or another organization, I know there's another organization that's building some homeless shelter, a brand new one in Glens Falls. I've just become aware of that. But in the event that they were unable to do something, we absolutely must. So we need to make sure that we have this available for people. And I know we've had a couple discussions on the side as well, which I appreciate because you're very concerned about your constituents and the county as a whole in regards to this. One of the things that we came away with from this meeting was that they have a very big project going on right now, which I believe is somewhere in the neighborhood of $1.3 million. And just to put that in perspective to the budget that we're working with, our budget for the next 30 years is not that much money for Code Blue. So we have to be very careful with the money that we move around. And like I said, we're last defense. If this place closed down or couldn't take anybody, they're coming to us. So we need to make sure.
But we don't have a facility. I mean,
well, we don't have a
we have
facility.
a whole different structure of how we...
We do, and I think that's one reason why we're kind of lucky. We have a lot of motels and hotels within our county, which we have contracts with. We've negotiated lower rates with them, and counties like Washington County actually do have a pretty grim circumstance when it comes to finding places for people because they don't have those resources. It's not Washington County's fault. It's just they don't have a lot of hotels.
And they don't have an Open Door.
And they don't have Open Door, and they don't have these other organizations. In fact, they used to be part of the Community Action, but they even pulled out of that a few years back for whatever reason. I don't know the reasons why, but so they do have limited resources for these kind of things. So. Obviously, an excellent organization like Open Door is a very good resource for them, which is close by.
All right.
Let's see here. The last 2 days, I've been down in Albany at the New York Public Welfare Association's Winter Conference. I'd like to mention that that was the 150th year. We've just entered the 150th year, so it was kind of like a celebratory conference. Unfortunately, we had we have a cloud over us right now with the government shutdown, so there's a lot of issues that were discussed in regards to, programs that might be affected from the shutdown. So with that said, I think we've discussed, I know a lot of supervisors in this room have been in either on emails or I've spoke with you directly about some of these issues. I know that Mr. Moore has been very involved in, keeping abreast of the situation. I would like to extend, my appreciation to everyone here because my feeling has been that you are all very concerned about the residents of our county and your constituents. and what might happen to them with the limited resources that we have, especially in some of the rural communities within the county that could be affected by this. So we're hoping that this will play out in the next few weeks and we won't have to exhaust the resources of meal sites and soup kitchens and things like that.
Okay.
We have been interviewing for the attorney position at DSS. We've had a number of applicants. We've offered the position to 2 people, but they have declined. One of them took another job that was quite a bit more paying, and the other one had a couple of other reasons that she decided not to take the position. I'll give you a quick update on Countryside because I know this has been kind of long-winded here today. The director of Countryside resigned back in November on the 19th. We're going to be interviewing for a replacement. That hopefully will be posted today and we'll get that position filled. On November 29th, I met with Pat Tadich from Planning to discuss a number of projects directly related to Countryside. She's working on getting a building study, a complete building study, done so that we can really figure out what sorts of things need to be done in regards to the structure of the building, improvements and possible grants that can be accessed to get that work done. She also updated me on the progress of a couple other projects that were going on there. In December, I was able to get a grant submitted to Betty Little's office, which is a state municipal facilities program grant. This is a separate item that we've been working on that I know, Madam Chair, we had discussed many times. And I wanted to make sure that got done, especially in light of the fact that the director left.
Right.
So I was able to get a lot of help from a lot of people, including Pat Tadich, and people who are working up at Countryside, who are instrumental in going through the building with me and really figuring out what's going to make sense, where we, might get funds to have some improvements that are going to directly, affect the well-being and safety of residents there and improve the working system up there. So the things that we're asking for is to install a new modern phone system. Their phone system, they're still on the old phone system. They're not even on the county system. They can't even take voicemail. So we're going to try to get that updated. Update the door alarm systems. That's a safety concern. We are looking at trying to get the fire and emergency alarm system updated, the emergency pull cord system updated, and mechanical doors updated to improve the facility, because we do have a number of clients and residents up there who are have mobility issues in their so those are things that we're looking at. The other thing that I would like to say is that I would like to let everyone know that Dee Park from OFA is really helping out a lot up there. She's been very instrumental. As some of you know, she used to be the director up there years ago. She has really stepped up and answered a lot of my questions and a lot of questions for others who are been thrown into the daily activities up there, the day-to-day activities that need to take place so that the residents there are served appropriately and respectfully as well. So I would definitely like to thank Dee Park for her help with that.
Well, she said she was willing to help in any way she could, and I knew she would step up to the plate and help you out with that.
She has stepped up of her own accord, too. She's, anecdotally, I was up there one day meeting with Amy McBurn, who is the person who's currently filling in, and Dee showed up out of the blue to, she's like, what can I help you with? What's going on? And she really, she jumped right in and was able to help us with a couple of issues. So it's nice to have people like that in the county that are willing to do things that are outside of their, the work that they're currently doing. So we're appreciative of that.
Great. Julie's turn. I'll be very quick. The revenue and expense for 2018, I have a total of what we're under budget right now, but next month will really tell the true picture, because in January, we pay all of December bills. So until next month, you're not going to have an accurate picture. I'm pretty positive we'll be under budget. And hopefully the revenue will match accordingly. And for overtime for the full year, we're about 400 hours over last year. We had quite a bit of training due to new employees, and our CPS calls the volume was extremely high. That's it? Any questions?
Wait a second.
How'd you like it?
Yeah, so Julie, on page 77 there, you have about 72,000 encumbrances left.
Yes.
We're looking at the bottom line there. So that, you've encumbered a lot of what you expect to be.
No. Encumbrances really are just what we have in purchase orders. So that money is encumbered. It does not include like our institution costs, our foster care costs, those kinds of things. It will be much greater than that. I would estimate about 1.5 million being spent in January for December costs. So that 2.9 million, you're going to see that reduced estimate by $1.5 million, give or take.
It looks like you're, if I'm reading that right, 3 million still left on the table?
Not, right now, yes. Any other questions?
Motion to adjourn, please.
And we've got one more
Yeah.
meeting.
Public health.
Sorry about that.
Thank you, that'd be great.
Okay, yes. Could I just make one request, though? A couple of times in the past, we've kind of rushed through the group that's last, and they spend a lot of time putting their agenda together. I think we should give them the courtesy of at least letting them kind of explain what it is they're after. We've had a tendency to want to vote on something, and they haven't had a chance to kind of get it out of their mouth. I just don't think it's fair to them when they have spent all the time putting their budget together. And I know we're going overtime, but I just feel that we need to be fair to every department head that comes before us and give them the time that they need. Okay?
Yeah, this is a lot of work to come before.
Well, it is, and all of a sudden it's like, how fast can we rush through because we know the next group is waiting? Well, unfortunately, that's the way it is, but it's not fair to that department head that comes in and spends all that time. So, thank you. And thank you both. Have a nice day.
Have a good weekend.
You've been thoughtful about it. I mean, the work that you guys have done.
You do that all the time.
I do
I
do
want
that
to
all the
mention
time.
that, last Thursday,
1 through 14.
About 3,500 different
I knew who was directing that.
households in Warren County, and so it's going to be 6 weeks for many of them.
Yeah, we could rotate
But I mean, getting the research process, the new application process, you know.
Also get more candy.
Kudos to you for your staff.
By the time it got to some legitimate stuff, which was, they wanted to appropriate from fund balance, stuff that...
How are you, Mr. Austin?
See ya.
Yeah, I just don't think...
Whatever happened to our,
Yeah. Give me your cell number and then I'll text you the next time.
Curious why, I've never seen you since I've been here, committee meetings on Friday. I think, why were they on Friday? And we had a holiday on Monday. Oh, good, just for January.
Okay.
Because Fridays are good for me. Glad. Okay, good.
Okay, yeah.
It's good to abstain. The ethics law, I think, has some provisions in there about filing a written...
Oh, yeah,
Well, see him on Ridge Street.
Working in the trail?
Fine.
Yeah.
Anything different than what I have?
Yes, so,
Oh.
right off the bat, it was like
Yeah.
half an hour, 45 minutes, and they only dedicated 15 minutes for it, so right off the bat, we were behind the gun.
The plan is to snap the papers, so give it back to her.
Thank you. No idea.
But that's what I do.
I didn't know that was Mrs. Clemens.
Yeah, I did not.
How are you?
Good, I was getting lost in the chair.
They've done the work.
Did you get a note?
She's an attorney, she's a partner.
I like it.
Good morning, ladies. Are we all set? Everybody here?
I'll move 1 through 9.
Mr. Sokol? Go ahead, Janelle.
A wise guy. I'll second it.
Not that we want to rush it along.
Go ahead.
Our department would like to welcome back all of our returning committee members and also welcome Supervisor Driscoll as a new member. And we just kind of want to make a notation that anybody's welcome at our department anytime you want us to kind of walk you around. If anybody would like a really special tour, we can make that arrangement as well, just let us know. But we are always happy to see you if you happen to be coming down to kind of introduce some of our people to you. Our first resolution request is to appoint and reappoint members of the Warren County Health Services Professional Advisory Committee for the year January 1st, 2019 to December 31st, 2019, per the list that was transmitted with the meeting agenda. It's also in attachment 6. This is a committee that's appointed annually by resolution for New York State Department of Health regulations, and a copy of our membership is available at the meeting in your packets and on file with the minutes. This is a meeting that's held quarterly.
All right, someone like to make a motion? Supervisor Loeb, seconded by Supervisor McGowan. Any questions?
Abstention, Madam Chairman.
All right, thank you. All those in favor? Oh, I'm sorry, Supervisor.
Question. Looking at the list, it's a huge list. How productive can a meeting be like that?
It is very productive.
25 people or something.
Well, we have a lot of different programs in our department. We try to get people that have the expertise in certain areas or that we work with so that they can kind of help us with our policies and procedures or working with the agencies. And we actually just added some people this year to try to help enhance that.
Thank you. Thank you.
All those in favor? Aye. Opposed? Carried. Thank you.
The next resolution request is to appoint and reappoint members to our local early intervention coordinating council per the list transmitted with the agenda. This is on attachment 7. Again, with New York State Department of Health regulations, we have to be appointed by board resolution annually. The membership list is attached and available, and this is a semi-annual meeting, so it meets twice a year.
All right, someone like to bring that to the floor? Supervisor McGowan, seconded by Supervisor Driscoll. Any questions? All those in favor?
Aye.
Opposed? Carried. Thank you.
The next request is to amend the contract with Kinney Management Services of Latham. This provides a K-check service to reflect a $50 increase. Documentation's on attachment 8. This is a part of our agency's corporate compliance plan. It helps us monitor our service providers for any kind of fraudulent activity, and this amendment's requested just to reflect the increase in price.
All right, someone like to make the motion? Supervisor Sokol, seconded by Supervisor McGowan. Any discussion? All those in favor?
Aye.
Opposed? Carried. Thank you.
This next resolution is a request to amend Resolution 242 of 2018, which amended Resolution 803 of 2010, adopting Warren County's corporate compliance policy to name the assistant to the county administrator as the county's corporate compliance officer. Documentation can be found on attachment 9. The county has to have a corporate compliance officer. Due to recent personnel changes, the assistant to the county administrator has been named the corporate compliance officer.
All right, someone like to make the motion? Supervisor Driscoll, seconded by Supervisor McGowan. Any discussion? All those in favor?
Aye.
Opposed? Carried. Thank you.
The next resolution request is to authorize one of our nurses, Laura Monroe, to receive reimbursement according to the CSEA union contract for a job-related course, Nursing 305 Information Management and Patient Care Technologies, and related course expenses upon the completion of the course obtaining a grade of C or better. The information on the course is 11. It is job-related. We just recently went through our transition with our electronic medical record, and it's something that will be good.
Okay, very good. Someone like to make the motion? Supervisor Sokol, seconded by Supervisor McDevitt. Any discussion? All those in favor?
Aye.
Opposed? Carried. Thank you.
The next resolution request is similar to authorize Jignasa Shah, our Public Health Program Coordinator, to receive reimbursement according to the CSEA union contract for a job-related course. This is a biology, anatomy, and physiology course with a lab, and we're looking to get reimbursement for that and related course expenses upon completion of attaining a grade of C or better. Her information on her course is attachment 12. And this is a course to provide deeper understanding of the body and its processes to provide the employee with information to carry out, enhancing her outreach and education on various diseases and things that she's doing in the community.
All right, someone like to make a motion to approve that? Supervisor McGowan, seconded by Supervisor Loeb. Any discussion? All those in favor?
Aye.
Opposed? Carried. Thank you.
This next resolution is something that we're actually excited about. It's to enter an agreement with Warren, Washington, Albany County's ARC to provide the opportunity for credentialed ARC clients to volunteer with no compensation, to provide support services work like filing, folding brochures, assembling packets, under the direction of the ARC Job Coach, which would assist our department. And we're looking for that to commence March 1st. And will be automatically renewed unless notice of desire for termination is provided with 30 days written notice. In addition, looking to authorize the Director of Public Health under the direction of the County Attorney's Office to make any kind of minor adjustment based on verbiage that would be like New York State ADA like related information.
Sounds like a good program to help you out.
It's actually a nice opportunity. Health Services has the need for assistance with filing and some support services. And the ARC agency has a workforce looking to volunteer, and they're looking for volunteer opportunities to assist other agencies. The ARC clients would work under the direction of a job coach, and they would provide any assistive devices that are needed for their clients to perform the duties.
Very good. All right, someone like to make the motion? Supervisor McDevitt, seconded by Supervisor McGowan. Any discussion? All those in favor?
Aye.
Opposed? Carried. Thank you.
There are no pending items at this time. Information for review, attachment 1 is our report of expenditures revenues for 2018. And Tom Driscoll, our fiscal manager, is actually going to cover that, and for the interest of time, we'll also review attachment 2, which is our revenue and expense comparison report.
Okay, as of January 16th, when I printed the financials, to give you an idea of where we stand compared to budget for 2018, so it's not much to show yet for 19. One thing I know that people are always asking is the revenues, and we are looking at, so obviously we haven't closed the year, so we're still looking at for our home care, closing that for December, for our WIC program, getting all the values of the food vouchers, we'll get that from the state for the whole year, we'll book those. And our preschool program will be the big one that we get around March or April, that will go and put all the revenues from July 1st till December, and we can load that in the state program and get that in our revenue. Our salaries, if you compare those again, we're looking at those pretty much should be final unless they have any last minute journal entries, but we are 85.32% of what the 2018 budget was for salaries. We're up in all categories, but overall the change from 17 to 18, we were only up 1.62%. Most of that is the fact that, again, we didn't have all our nursing positions filled, which we are really diligently trying to get filled. We need those positions filled. We have utilized per diem, which is great, and I guess that's it. Overtime was a lot of it this year. I hate to say was a lot regarding our new program that we got in the billing program. We have put a lot of time into that, especially during the summer and into the fall. It's definitely slowed down, so we're hoping that will be better. Attachment 2, this is again just a comparison last year at this time pretty much to today. And again, you'll see the differences. We are expecting, we have to mid-February to get all our expenses in, and we don't have that many more to go, so I don't anticipate that to get too much. But the revenues, again, you'll see last year to this year, and again, that is because of our preschool and everything else, because this 12/31 for 17 is final. So everything was booked, and of course I can't compare that yet because we don't have everything in yet. But, you know, overall, I'm just anticipating that our year-end effect to the county will be what we budgeted or less, so.
Very good. Any questions from the committee regarding the finances? Supervisor Loeb?
Pardon me, Madam. I just want to make sure that in the previous resolutions, attachment 11 and attachment 12 were both covered. There's two courses, two different people.
One course, two different people.
Two different people.
Two people.
Right, I didn't hear the first course. I just heard the anatomy and physiology.
We did it.
We did, okay. All right, very good.
We're taking a little nap there.
No,
Ms. Bramer?
yeah, we've all been here since before 9 o'clock.
I realize.
No, it's okay. What are you anticipating, thank you, Chairwoman, what are you anticipating are our outstanding expenses
To still be put in?
for 2018?
For
Yeah.
2018, at the most, I would think $1 million, because we have all of our preschool and everything that we wait for revenue is in. All our expenses pretty much for our home care is in. What we're waiting for is the WIC food vouchers, we put that in, but we can wash whatever, if we put $500,000 in expense, we put $500,000 in revenue. So I do know we still are waiting for some early intervention expenses, so I'm waiting for that, so I'm hoping, I mean,
We'll definitely be under budget then, if you only think it's $1.5 million.
I think $1.5 million in revenue was my guess, and $1 million in expenses more. So when I look at the bottom line, this is, again, my guess. I'm thinking like 2.2 is what we might come in about, that's my guess. We budgeted 2.3. We did 2.219 last year, and I just said. But I'm hoping, in my hope is, and again, until all the expenses get in, we have one business that hasn't told us for a whole year. And I'm on them, and I'm on them. And it's been a nightmare, but I did talk to treasurers. We are going to approve that and put that on a list. So we know that that's due. We're going to put it out there as a liability.
Can't we tell them if you don't bill us soon, we're not going to pay you?
I would like to say that. You know, the conversations
Although
I've
I
had.
don't want to do that.
Because, yeah, it's been quite the colorful conversations with me. But, and that's with our preschool folks. But, you know, he's dealing a lot with this thing. But the thing is, we only have 2 to 3 kids at the most in this program. So we're not talking most of the kids. So we'll be able to do a fairly accurate estimate at the end of the year, which is what we always do. If anything we haven't gotten in, but we know it's still outstanding, we put it on a list and we still add it into the expenses.
Okay.
So I talked to Ron much about that.
Well, it
I got off
sounds
the phone.
like we're in good shape. Thanks.
You're doing a good job down there. You know?
So next is the status of our referrals, which is attachment 3, and Val can going on there.
Pretty much it correlates, you know, if you look at the number above, it's not that much lower. I will tell you that in the month of December, though, we did have one nurse out that was down for a couple of weeks, and I did have to quote, we do keep a liaison at the hospital. It's one of our employees, and she's down there to bring us referrals. And unfortunately, we had to pull her back, take her out of the hospital to see patients. So that prevents us from getting the referrals, but our goal is we have to cover what we have. So that could be why we, you know, certainly lost a couple there. But I have been told from Glen Falls Hospital that they have been running a low census for the last 3 months.
And usually around the holidays, too.
Yeah,
The elective
planned
surgeries
surgeries.
are a little less. Also attached, just for information, emergency response and preparedness activities on attachment 4, our rabies report for 2018 is attachment 5. As an informational item, with meetings, we completed a request to hold meeting and conference form, and we're submitting this basically as a pre-scenario to authorize the provision to serve a light lunch during our quarterly professional advisory meetings. We've done this for over 20 years. And we're looking not to exceed $550 a year. The typical average cost per meeting is around $125, which covers the water, the paper products, the pizza, or whatever we serve. Attachment 10 has that laid out, but instead of doing a form quarterly, we're looking to do it once a year so that it's kind of done for the year. Any questions or comments on that? Yes.
Supervisor Bramer.
Can we do it for the Health Services Committee meeting?
Yeah, yes. No, what I was going to say is I just clued in on you talking about the water. So I would request that you do not buy plastic water bottles.
Okay.
You could use just
Water.
just water.
We can do that.
Thank you for the consideration.
Under staffing update, with all the positions that we kind of jockeyed around with some of the changes in our department for the 2019 budget, we filled the majority of them. We have some really great people that we put in a place. We're optimistic that we've selected qualified candidates to help our agency with our services and programs, so we're excited about that. Nursing positions, as mentioned earlier, we're still recruiting for that. We've got 3 to 4 open positions that we're looking to fill. And that's what I have, unless anybody has any questions.
Anybody on the committee have any questions? Don't forget, she's given us the opportunity, if you want a tour of what goes on downstairs, you might want to take advantage of that. It's really a nice thing to do. You meet a lot of people, then you see how hard they have to work. All right, with that then, I supervise.
Just a quick one for all the home care nursing. Spend a lot of time out in the community looking at sort of things.
We'll pass that word along. We have a staff meeting coming up next week.
Very good. Anything else, Supervisor Lowe?
Madam Chair, as I communicated with you by email, I have 2 items I'd like to bring up, one regarding a nursing home and another regarding public health. Actually, both involve public health. You may have seen, everybody may have seen the editorial about the anti-vaxxers movement in the world. They called it an American phenomenon, but the people against anti-vaccinations it's a worldwide problem. It's a worldwide issue. It's a local problem everywhere in the world. Public health, I would say most people don't realize that the health of our communities today that we take for granted is the result of all the work from the public health departments that have been supported by governments. There's a real loss of respect for public health, and it is threatening our local health. So I would like, we have money we're looking for ways, how can we spend our excess fund balance. I would like us to ask our health department to come up with an aggressive public relations program for our area to increase the participation in vaccinations and perhaps other areas where public health could help our community. I would like us to ask them to do that. The second thing I'm interested in is the nursing home. You may have seen the story today about the nursing home selling for $10. That issue was discussed at our support services committee, and that particular issue we're going to follow up on. But what I'm concerned about, which was something that Supervisor Beatty mentioned very passionately, is the poor care that our elderly are receiving in our nursing homes. We used to have a 5-star facility across the street, and now it's a 1- and 2-star. As you know, I asked if I could mention this or talk to the public or New York State Health Department about this, and the committee said, yes, go ahead, and with zero progress. After the meeting on Tuesday, I spoke with Chairman Conover, and he said, you know, New York State is never going to give us any jurisdiction, or they're not going to give up their jurisdiction. But that doesn't mean we can't become a pain in their butt. So with that in mind, I would like to suggest, and that pain in the butt meaning we can help the private citizens. People, there's a line, an 800 number of people can call New York State to complain, but they're not getting any satisfaction. what Supervisor Beatty mentioned was an issue over ginger ale. That's so small compared to the horror stories I've heard from, well, 3 individuals whose families are in these nursing homes. And these are really serious situations, and nobody's doing anything about it. So following up on Supervisor Conover's comment, I would like us, as representatives of the people of Warren County, to start a hotline so that we can be the force that deals with New York State. People can also, they can always call the 800 number, but they could call Warren County, and then we could pass that information, those requests on to the State Health Department, also copying the governor's office, also copying our legislators in Albany, and also copying the Post-Star and the Times-Union, so that we can start being a real pain in their butt, because unless we start doing something, our elderly are going to continue to suffer, and I'm not worried how it reflects on this board. I'm worried about the fact that we're not really helping our senior citizens and our elderly in these nursing homes as much as we could. So I would like this committee to ask the health department to put together a concept of how we could follow up with the hotline. And I would like the committee to discuss it. Maybe the committee says we don't care, but I think it's something that we all do care about passionately. I've heard Supervisor McDivitt talk about it many times over the years. I think it's time we stepped up and do something about it.
Well, can we discuss that some more next month, because we are so far behind now. I just don't think we want to get into a lengthy discussion. We're like
Quite all
an
right.
hour
We
behind.
put it on the table.
All right, so, well, let's
Thank
put
you.
it on the agenda for next month and put it at the end if you want to discuss it then. I just think that's the best.
Thank you, Madam Chair.
Okay, you're welcome. With that, I'll entertain a motion to adjourn. Supervisor Sokol, second by Supervisor McDevitt. All those in favor?
Aye.
Aye.
Thank you. Have a nice weekend.
Hey, Bill?
Wait a minute, with some...
Bill, I'm sorry. Southern Adirondack Library System has basically a hotline